Did it work, my friend?
Hey, what's going on? What's
Oh,
going on?
it worked. Oh my
It worked.
God. Oh my
There we
God.
okay, there we
God is
go.
good.
God is good. What's
That
going
God
on
is
with you?
great. All I
All
know
the
is that I
time.
gotta figure out how this social network thing going on.
Word,
I gotta figure out how this stuff works. But how
word.
you been, man? Good to
I'm,
see you. I haven't heard from you in a minute. How's
right,
life?
right, right. I'm doing good, hanging in there. We do what we do.
Are you on the phone right now, bro? Um. So what's going on in Richmond? What y'all been up to? Because I've heard some crazy stuff. Specifically
Yeah,
with apparently you got people out here that are breaking bones and stuff. I mean,
exactly. I'm like, I don't know how many people are familiar with it, but there was a book written a while ago called Medical Apartheid. And it was
oh
talking about
yes,
the whole talking about all of the racism and mistreatment and maltreatment and negligence, etc., being perpetrated
hmm
upon um black people, however which way we want to
basically, yeah.
call ourselves. So, and as important as that is, it's like, well, now it's sort of like we get a flash pan of that in Richmond with this racist NICU nurse that they've caught for the
And
second time. I'm like, it's as crazy as it is, as bad as it is, that to find out that she's doing it, it's even worse to find out that she did it before and they caught her before. They suspended her and let her sit at home for a whole year getting paid, knowing she did it. And then as soon as on the grapevine side of things, like, they fired one of the administrators. And then once they fired the administrator, they brought her back.
well, I mean, I could tell you this much: the way I think the health system works out here is I've come to the conclusion that if it is affecting the minorities, it is
Hmm.
not a problem for the majority.
Exactly.
And
Exactly.
and this is me coming like I mean my son when my son was born at Chippenham. I mean, like my wife struggled. Like I mean, between her, like that is the first time in my life that I actually learned, like when they tell you to advocate for your family and your friends, whoever is it that you're at, you're at the hospital with, like they
Hmm.
mean it because this is business. At the end of the
Right.
day, there are hospital administrators. There are people
Mhm.
out there that are getting MBAs and MHAs, like Masters in Health
Right.
Administration, and what they truly only care about is the end goal, which is to save money.
Save a dollar. Save a dollar. Yeah.
Exactly. So one of the craziest nightmares that I have is when my son was born. I remember that night, like we went to the hospital, and like I didn't know. I mean, this is the first. I mean, I'm a first time parent. I don't know how the system works,
Right.
and the whole time it was between nurses and like other level of individuals, with the exception of an actual what do they call it, obstetrician or gynecologist or whatever the hell, the actual doctor,
Mm,
the MD.
yeah. The say the word again. You got it right.
Yeah,
I
I
don't
think it's
want
like
to
an obstetrician. Basically, my wife's
obstetrician.
doctor.
Yeah.
Yeah, but basically, my wife's
Yeah.
doctor. They could have easily called her, and she could have came in there and fixed stuff up. But yeah, like my wife went through say about 12, about 6, 7, 8, well, almost 8 or 9 hours of agony of just trying to figure out like what's going on. Um, my son ended up having a jaundice, and like he was in a NICU, just like these children. And
Damn.
one of the craziest things that I thought about when I saw this stuff that's happening in Richmond was I remember like when my wife had to get an emergency C-section. So, and
Wow.
even though she could have delivered regularly, but because of negligence with hospital administrators. Um, they did an emergency C-section, and I remember when all that transpired before I like almost basically threw up in my own mouth and like like oh my god, it was just a little traumatizing for me. What I saw, like she literally told me, she said, follow Zakaria all the way to wherever the hell is that they're
Mm-hmm.
taking him.
Right.
And like I'm from Somalia. I have a younger sister. I have four younger siblings, and my second sister actually she was a breech baby, and due to negligence at the Somali level, she ended up having a lot of complications. To this day, she lives in a group home. So you can
Right.
imagine what my fear is.
Right.
Sorry, you're breaking up. What'd you say?
No, I'm. Go ahead. I'm trying to bounce off the breaking up stuff.
Yeah. So yeah, like, but that was in Somalia. Like, how can this happen in America?
Right. What
Like,
I Well, I think that's one of the things. Like, a lot of people do think that if you're in America, you're automatically you have automatic access to whatever the best is. If you're in America, you're going to automatically be given a red carpet walk down to whatever it is that you're looking for. So whether if it's luxury, they think you got complete access to it. If it's medical treatment, they think you got absolute complete access to it. And the reality is, if you don't have the complexion for the protection, you can very well end up in situations that just sound unheard of, sound absolutely nightmarish.
mhm,
And so, I've been on the receiving end of some terribly horrible medical treatment. Um,
mhm,
I've had family members on the receiving end of terribly horrible treatment. This it sounds crazy, but as crazy as it is, it's like I'm almost not surprised that they found a racist nurse breaking bones on babies. I'm like, I'm not surprised because I've seen such ill behavior from medical personnel. You went out. You still there? Yeah, it looked like you're still there. Can you hear me? Uh-oh. Yeah, it looked like you're still there.
can you hear me?
Can you hear me? I can hear you.
Yeah,
I can
no,
still
this
hear you,
meeting's currently. I might
but
have to rejoin you again.
okay, yeah. So while he steps out, let's see, we'll be waiting for him to come back in. Okay, he's coming back in. There we go. There we go.
Can you hear me now?
Yeah, I
All
can
right.
still hear you.
So
I can't I can't see you.
I might have to rejoin you again.
Okay, yeah. So while
So
he
so
he
so
steps out,
so basically,
let's see, we'll be waiting for him to come
no,
back
I'm
in.
here.
Okay, he's coming back in. There we go. There we go.
I'm here. I'm here. I'm chilling.
Yeah,
You can't.
I
Yeah.
can still hear you.
All right.
I
Well,
can't.
Well, we're gonna figure out the technological aspect of this at another time.
Okay,
But
yeah.
what I just wanted what I want to say basically is
Let's see. We'll be waiting for him to come back. Come back. I'm here. Okay, he's coming again. There we go. There we go.
I'm here.
Do you have do
Yeah.
you have
You
YouTube
can't.
pulled
I
up?
can start hearing me. I have
Yeah,
like.
well, we're gonna figure out the technological aspect of this at another time.
Okay, yeah.
What I just wanted what I want to say basically is sorry. Can you hear me?
Okay. Yeah, I can hear you.
I had
I
to.
think
I
did you
think.
have YouTube pulled up? Did you have like have it on
Yeah,
two?
yeah, I did. Is that not
Okay.
bad? Is that not good?
Yeah, that's bad. That's
Oh, I just wanted
that's
to
what it
see
is.
myself. My bad.
Right.
Shit.
I feel yeah, because I did that too.
I was like, I was just
I
trying
had
to see my pretty face.
to word. So yeah,
But like, let's going back. Like, doesn't this make you wonder though? Like, you know, there's a misconception that we have the best healthcare system in the world, but
yeah, it's a
nothing
it's
just
a
happens.
it's a gross misconception because I mean just off the general structure of it, you know, Americans like to think that we have the best health care when in actuality we don't hardly even have health care. Like we have
Mm-mm.
we have health insurance. You
Correct.
you might be able to say we have the best health insurance
Yes.
system, but it's
Yes.
not necessarily the best health care because yeah, the penny pinchers will call the doctor at any given time and say, no, y'all can't do that. And
Mm-hmm.
regardless of what it is, I was just reading an article earlier today where no, well, there was an article I read, and then there was a post on Instagram from a doctor
Mm-hmm.
who said that she was in the middle of surgery
Mm-hmm.
and the insurance company called demanding that she come to the phone and fully aware
Are you
that
serious?
the patient is on the table, fully aware she's been cut open. No, get her on the phone. And as wild as that is, I'm like,
Jesus
and
Christ.
the doctor went, and the doctor left the surgery to get on the phone. And they were trying to tell her, no, you can't do this procedure or something like, or it can't be this long or whatever it was. But yeah,
We need a
people say,
platform. We need a
yeah,
platform to expose the inequity in healthcare because it's
exactly.
not it's not it's like I've come to the conclusion that it's not even about race anymore. It's about profit. Period.
It's it's definitely about profit. And I think that was one of the things, like you're never gonna know, we probably won't ever find the real scoop and the real story behind that Luigi,
Oh yeah, the kid that went
the
nuts.
guy that they say did the shooting and whatnot. But
Mhm.
you know, with at least with narrative that's out there,
Yeah.
narrative that's out there shows and proves that anyone can be a victim to the health insurance system
Yeah.
because
It's
the way they present it, he's
mhm.
wealthy. He's a child of significant wealth and
Yeah.
still ended up with pain that
Yep.
demanded treatments that his insurance company wasn't going to pay for.
Yeah. And it's sad that even with because in most African countries, and I know you've lived um, in Ghana for a while, like you pay for your health, you pay for your insurance as you're going along.
You pay
Um,
for it right up front.
yeah, yeah, right up front. I can't really speak more on Somalia, but like I remember when we were living in Kenya as refugees, when my dad took me to go get my, anything related to dental or I don't know, shoot, I got circumcised at a really late in life when I was like eight
Mm,
years old, pay that out of pocket.
right.
So, the here, you have some benefit, but there's also these small little stipulations that are in place that you have to be cognizant of. And I think that's where it comes down to. equity. There really is. You could sit over here and say it's equity based on race, but it's really not equity based on race. It's equity based on, I still don't know. I haven't figured it out yet.
Yeah, it's really, I mean, one of the biggest things about this country is whatever problems exist, like yeah, every country has problems.
Yep.
So, but whatever problems exist, the the complexity of the problem
Mm-hmm.
increases as you go down the list of the identity labels that
Correct.
get attached. Yes, we're all humans, but melanated humans have more complications down the list
How
than
about the
non-melanated
name?
humans.
How about the name? I mean, not to start something, and this is not me speaking on behalf of my employer or anything that I'm associated with. This is just Muhammad talking right now because I talk
Mhm.
shit. um, yeah, that Luigi kid. Like, I mean, I don't know what his ordeal was, but maybe the kid got the short end of the stick because of his name. I mean, like, look, things that are important
Mhm.
such as name sometimes even come into play. There is bias. There is no bedside manners with health professionals nowadays. Like,
Right.
my wife had a procedure about a couple of weeks ago, and the individual obviously did not even spend more than, I'd say, by 2.5, yeah, about 2 minutes on the phone with me, telling me like boom 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 boom, and I'm over
Mhm.
here asking questions, like taking notes, and it's like, all right, well, we'll see you at the next follow-up
Mhm.
6 years from now.
Yeah.
Let's repeat the same procedure.
Mhm.
And I'm
Yeah.
sitting here like, wait, what? Like, can you tell me like what's, but no, it's
They
business.
will it's definitely run like a business, and they,
Yep.
I had to pop into a patient first, and I end up, the doctor that comes in to see me is like standing at the edge of the doorway for the whole visit and trying to ask me questions, and I'm like, I'm already sick. I'm like I don't have the strength to yell the answers and you can't hear me from all
Because he
the
gotta
way
go.
over there.
He needs to. Yeah, no,
So
he needs to make this transaction really quick so he can go to the next one.
exactly. I'm like doing their best to shoot out the questions as fast as
Hmm.
possible
Yep.
and to hurry you along. You trying to complete my sentences when I'm
Oh,
trying to
oh,
tell
oh,
you what's wrong with me.
oh, oh, you got stuffy nose. Oh, you got stuffy nose. Is it left nostril? You don't even matter. Don't even worry about it.
Mhm.
Here's the little Vicks for you.
Yeah, and I'm like, and they're like the last time I went, the doctor was actually like really just trying to hurry me up, but I'm trying to remember like what they were trying to diagnose the whole problem
Mm-hmm.
without hearing the whole list of, okay, so what's wrong with you? So I start on my list. I'm feeling, oh well, what you need to do is, I hey, I only got out one symptom. You can't possibly tell me
No, you
I
can't.
need XYZ if you've only
Mm-hmm.
heard one symptom. And then the doctor was like, I feel bad today too.
Okay. Well, one of the funniest stories that I have is like years ago. I think this is like back in 2000. It was a long time ago. I went to one doctor, and I had migraines. And I've had migraines for years. I even get Botox right now. Um,
Mm,
the man said to me, he said, "Listen, brother, I'm gonna pray for you." I said, "Okay,
wow.
dokie. I'm gonna go take my insurance. Can I get a refund on my copay?"
I'm like, oh,
He said, "I'm gonna go." He said, "I'm gonna pray for you." He said, "Go to XYZ pharmacy and get yourself some magnesium ointment."
wow. I'm like,
I said, "All
yeah,
right, I'm gonna go pray."
there's way too many, I don't know, there's way too many bad professionals in the profession, bad people, bad
Yeah.
workers.
Well, with
And I
respect, like,
get that,
mm-hmm,
I get the notion of yes, the system is under pressure.
mm-hmm,
Um, the workers are overworked. I get that, but I would also say, in almost every industry in this country, the workers are overworked. Some kind of way. I mean, being overworked is just not a good enough excuse
Nope.
for poor delivery of service. I mean,
Mm-hmm.
I, you know, I'm I worked as a teacher. I was overworked. I couldn't just walk into the classroom kicking tables down because I'm overworked. I still have to present and behave in an appropriate
Exactly.
and a professional manner. So,
But maybe this comes down, and this is, I have friends that are in the medical service, medical industry, and like, my wife's a therapist. But I think there needs to be some bedside etiquette
mhm.
classes. I mean, I don't know. Like, I have no desire to ever become a physician, but maybe perhaps that's where we need to start with, you know, like
Mhm.
bedside etiquette, like how to effectively communicate with patients and their families.
Yeah, I mean, they definitely need to. I remember a long time ago,
Mm-hmm.
when I was studying to become a teacher.
Mm-hmm.
One of the courses that we had to take was effective communication in I can't remember the exact terminology that they use, but basically the course was set up to try and show you and demonstrate, teach you how to communicate with people from various backgrounds. Like you wouldn't necessarily,
Right. Yes.
uh,
Cultural competency.
there you
But
go.
they taught
So
y'all that at that. How long ago was this?
this was I get. I mean, I'm an old dude, so this was early 90s when like I said, when I was
Do
studying
they
to
still
become a
do
teacher.
that?
So this was my undergrad program. So, and for me, I kind of felt like it was a useless class because I felt like, look, I mean, I know I
What
know
was the
how
name
to
of the
talk to
class?
people of various backgrounds, but there were people in the class with me, and I'm like, oh, oh, they need this class.
But
Like,
what was the name of that class that you took at that time?
I that's like I said, like I cannot remember. I wish I had my transcript like on I could pull it up and
Because
see.
like
I
I'm
can't
like
remember the name of it.
because I'm a nerd. I'm very much concerned. Like I'm trying to figure out if there is some type of a cultural competency or effective communication classes
Mhm.
that are in place at the medical school level right now. Um,
That's a good question because I would like to assume that there is
mhm,
one, but like when all of the stuff started jumping off with the cases of police brutality,
mhm,
one of the things that came out of the after action reports and the research and whatnot was that there was no training in effective communication and cultural competencies with
nope,
people from various backgrounds with the police. And
nope,
that's not to say I'll never be the person that's like trying to defend the police,
nope.
but it is one of the things that came out and people were rather shocked. They were like, you know, well, we just assumed y'all would get that training. And
Mhm,
whether or not it's going to have an impact, I mean, a racist is going to be a racist. A racist person is going to sit through training and still walk out of the training being racist if they're committed to it. But
yeah,
if you don't have the training,
mhm,
you know, because it's easy for someone not to be a racist, but still not understand how to access their own empathy and talk to a person in a different kind of way. It shouldn't be easy to
yeah.
feel
But
like,
but
but
like I wholeheartedly understand the concept of whether it's racially driven or not. But I think like I've come to the conclusion that yes, race is an issue, but more importantly, like there are people out here that just have lost the humanistic and the human in them.
Mm-hmm. I can see that.
Like
I can
it's
see that.
like, I mean, I got stories for days about, one of the funniest stories I like to tell is like when my wife and I, when we had Zachy, like the nurse came into our room and was like, "Here's the paperwork for the, for the Medicaid. Here's the stuff for the whatever, like anything basically related to welfare." And her and I are looking at each other like, "We're good. We don't need that. Like we're both professionals. We like, how do you quickly assume that?" And
Right.
if I take race out of the factor there, what they saw was an African Muslim, whatever, a guy named Muhammad, and a
Mm-hmm.
Catholic Latino woman named, Jennifer, and her mom, Maria, who just happened to be there to support her out through this birth process.
Mm-hmm.
And they quickly assumed this family needs free diapers or free whatever that formula that my son was taking at the time. Like, you know, it it was confusing for me because the way I look at it is like I worked hard to get where I'm at. I
Right.
don't need you. I want you to judge me based on how you interact with me. Don't judge me based on my fucking background, my skin color, or my name.
Right.
But yeah, but it comes down to that's the reality. That's exactly what's happening. Like it's, if my
Yeah.
wife's name was Becky and my name was Brad, she would completely be different.
Well, yeah, that's true. I mean, I hear what, like, for me, I'm a little hard pressed not to
Like, yeah,
pick
yeah, yeah,
on
yeah.
on
You see,
racism.
yeah, but like, see, that's the thing. It's like, you know what? You and I are about to have our own little talk show host. Okay, this is what we're gonna do. Like me, I think I've gotten to that point where, like, yes, race is a factor, but
Uh-huh.
class is also something that's bigger.
Classes. I wouldn't necessarily. I wouldn't necessarily say bigger. Class is much more
Hmm.
intricate. It's more complicated and complex. It is a very intricate and tricky um
Because
dynamic that does complicate the.
In Virginia, you guys, what I've learned in Virginia is like y'all have old money and new money.
Oh hell yeah! Oh hell yeah! Now that's when you
I did
really
not
get.
know that until I really saw it. I said, "Wow, this is real."
you- It's yeah. It's now okay. So with that, I'm like, from what you've seen, now do you see old money, new money? You see that separately? You see that outside of
I see that everywhere. I see that at
a
work.
racial a racial
Yes,
context? Or
yes.
within.
Because without delving into my experience, I've worked with prominent individuals that were minorities who obviously come from old money, and I've
Hmm.
worked with prominent individuals that came from new money that just happened to be white.
Hmm.
Yeah, it's a completely different dynamic.
Okay.
So
Okay.
what I joke around is like, look, you're either black or white.
Hmm.
Then you come down to another level. Okay, do you have old money or you got new money?
Uh-huh.
Now, if you got
Right.
the old money, you go to another route. Now, if you got the new money, you ain't different any more than the white guy who has new money. Because technically speaking, that white guy who has new money is just a
Hmm.
redneck.
Okay.
So don't
I
quote me
think
on that.
mhm. I think I see that. I think I see what you're saying.
Like,
Like
we will
new
not
money.
win. We cannot win. You can't win. We are not gonna win. Our children are not gonna win.
Well, that's an interesting statement. If you say our children are not gonna win, old money
They're
versus
not.
new.
Yeah, no, they're not, because like, all right, this is me coming from, and you know what? This could be like a whole different topic that we could talk about on another episode. My children are mixed.
Mm-hmm.
My parents had money in Somalia, and to this day,
Oh,
they
okay.
on and off they sell an asset here and there, right?
Uh-huh.
Now, my wife, on the other hand, she's she's Latina from New York. She doesn't come from that level of old money that I came from. Because I
Mm-hmm.
went from having old money to no money. I still got no money. Okay. She, on the other hand, is on a, middle class level.
Mm-hmm.
In order for me to get my children to that point where they're going to be accepted, or at least at minimum, if my son says one day to me, he's like, "Dad, I want to go get I want to get an internship at a member of Congress office in DC, but I don't have any place to stay." I can say, you know what? I have an apartment. The first apartment that I bought is in Arlington. You can stay there. I'll kick out the tenants.
Okay.
But when back in the day when I wanted to do that, I couldn't do that.
Right.
So like I've come to realize, like, it's race, and then there's class.
Uh-huh. So,
So you're gonna invite me over to your next show? Because at this point you're like, you know what? Nah.
oh no, no, we can definitely no, we can definitely keep it going. I was about to ask you, like, if
Yeah, and I'm in my
this is a
garage,
bit
by the way.
this is
Okay.
it's a bit of a weird question because it's like this, like I'm sort of like grappling with this notion of, okay, if you got no wins, if you're
Hmm.
never gonna win, then why are we so attached to remaining here? Like, old money, new money. Old money's always gonna trump new money. Old money's always
Yes.
gonna look down on new money. Old money's always gonna figure out a way to separate and
Yep.
try to oppress you. Like, even if